So shoulder pain in general, I tend to think about two separate categories. So I tend to think of people maybe 30 and younger, and then kind of 30 to 35 and older. So in our younger patients, what is causing shoulder pain almost always is either instability or overuse. So either kids have loose shoulders or they've had an injury to their shoulder, whether it's playing football or basketball, where their shoulder may have come out of place. Some people are made just ligaminously lax. We say those people have what's called multidirectional instability, so their shoulders are just loose baseline. Or sometimes it's just kids are throwing too many baseballs or decided to go out and shoot 1,000 free throws. So the kids do a lot of overuse things as well. And in our older patient population, typically most of the pathology we see is rotator cuff related. So either people have irritation or inflammation to the rotator cuff, we often call that impingement, or some people actually have tears, whether they've had a fall or an injury and had a traumatic rotator cuff tear, or sometimes as people get into their 50s and 60s, that just seems to happen with wear and tear over time. So in our younger patient population, the kids that do have multidirectional instability, not to generalize too much, but we see a lot of it in swimmers, a lot of repetitive overhead use. We see it a lot in our volleyball players, our tennis players. Those kids that have ligaminously lax shoulders are also the ones that tend to be able to throw the baseball the hardest, or swim the fastest, or hit the volleyball the hardest. And so those kids that are relatively loose jointed also tend to be some of our better athletes. And so we see a lot of kids that either they've started playing a whole lot more or swimming a whole lot more, and they've just overdone things so that their shoulder gets a little bit weak. And once it becomes weak, then their rotator cuff doesn't work quite as well, and their shoulder becomes essentially even more unstable because their muscles are no longer really helping to hold the head ball centered in the socket. So most of the time for those kids, we just get them on a good therapy regimen, lots of rotator cuff strengthening, maybe have them back off of their sports related activity enough until they get things calmed back down. But most of the time we can get those people better without surgery. That's different than the traumatic dislocations, the kids that are playing football and dislocate their shoulders. Almost always those require surgical intervention. So typically when you dislocate your shoulder, you tear your labrum. Most commonly your anterior labrum, that we've seen quite a few athletes lately that have also torn their posterior labrum as well. But once you've had a traumatic instability episode, unfortunately in our younger patient population, the recurrent instability episodes, or the likelihood of having another recurrent instability episode, is really high. So we've kind of learned the hard way over the years that most of the time those people are better served with surgery to go in and repair their labrum, therapy, and then 6 months or so later they can get back to their respective activity.